Hi, everyone. This is Samuel Collins, your coding and billing expert for chiropractic and ChiroSecure from HJ Ross. This month's program, we're going to try to give you something, or this week's, I should say, is give you something a little bit more practical, hopefully something you can use, because of course it's the new year. But the new year has come and gone. I mean, heck, it's February 1st today. So let's talk about what are you doing about your fees? What should be my charges? Were there any updates for this year? I'm sure you're aware that Medicare made some changes. I'm not saying it went up a lot, but at least it didn't go down as much as they have, which means it does affect other fees. So we want to start to look at what's happened with Medicare, work comp, but also with relative values. But more importantly, how do you set up a good, competent fee schedule that's fair to you and fair to the patient? So let's go to the slides. Let's take a look at what's going on and let's kind of focus in on here. Please take special note, of course, here is my email address, our company address, HJ Ross Company. You need help with coding and billing, we're the place to go. But let's talk about fees. I think the one thing that we have to always focus on is what do patients want to know? Well, I think it's common. Your staff probably has to answer it all the time. How much does it cost? What is the fee? And so I think we need to look at what is our fee? How much should I charge? What is actually reasonable? What's fair? What is the value though? And this is something I want to kind of focus in on. Think of it this way. There are offices who charge more and get paid. Why? Because they deliver a value for it. So you have to kind of think along the lines of, am I delivering a 99-cent store, which is nothing wrong with that, or am I delivering something more high end? So in other words, put the value to it because that's certainly going to change what you can charge. So you'll hear this term UCR, or usual, customary, and reasonable. What does that mean? It's the amount paid for medical services in your area. What is usually, what is customarily and reasonably payable or charged? It's usually what's charged for a doctor or service in your area. It falls within a range. And again, that's going to vary bit by bit, and it's considered necessary. The issue here is who determines that? What is usual, customary, and reasonable? Well, there's the insurance model. And as you're well aware, the insurance model is something that an insurance company determines what they feel is necessary. I mean, we've all seen this. You call an insurance company and you say to them, what do you pay? And they say, oh, we pay 80%. Well, think of that for a moment. When they say they pay 80%, well, 80% of what? And so what if you bill $100 and they allow only 50? That means they're going to pay 40 regardless of what you bill. So always keep in mind what they think is allowable may not be what you're billing. So that's going to vary office by office, geographic region, state by state. So we definitely want to have some type of a formula where we can start to look at what is honestly usual and customary and reasonable. How do we figure that out? Well, partly I think we have to figure it out from the patient value model. The patient value model is what does a patient value? Here's something interesting. I've practiced with my dad for many years. I've been teaching seminars now for 24 years. And the thing that I find interesting lecturing across the country, doctors who charge more make more money. Now, I know that sounds like, well, of course, Sam, they're charging more. What I find interesting, they charge more, they have more patients. It's not that they charge more, they have more patients because I think they put a greater value into the service. In other words, the patient value model, what is it worth? Does it feel like a $25 treatment or does it feel like a $100 treatment? Am I really getting the value out of it? And a lot of that comes back to making sure the patients understand what we're doing and why. So one of the ways to do this to start to judge a fee is not just based on usual customary, but what is the relative value of one thing to the other? And I think this is where we as a profession often lose out. I will say unequivocally, chiropractors on average probably use about 6 to 8 codes on a regular basis. A couple exam codes, adjustments, therapy codes. And I'm going to say to all of you, I bet you half of those codes you have at the wrong or incorrect value. In other words, let's say you're billing $30 for a service, but the insurance company is willing to pay 70. How much are they going to pay you? 30. Now, how would you know they're going to pay 70? Well, this is one of the ways through relative value, starting to understand. Now, relative value is just something developed out by the federal government. In fact, it started in the early 80s at Harvard, where what they took is all the expenses of practice. So every CPT code has a relative value, and it means the value of one code to another, kind of like a house. If in your neighborhood they sold a house for $1 million, that's the same size, lot size, same amenities as yours, what is your house worth? Well, relatively $1 million as well. And so I want you to use this kind of in that way. So this is updated every year. CMS takes it over and it just gives the value of one code to the other. And here's what I want to do is I want to do a little exercise for you to look to see whether or not do my fees actually make sense for what I'm doing. So I want you all to think, and if you want to do it right now, just take a piece of paper, pencil, pen, whatever, write down what is your fee for a 98940, or just think about what is your fee. Then conversely, what is your fee for a 41? What is your fee for a 99203? Mid-level exam, new patient. And let's do one more code. Let's just do massage. Now I'm just picking these four as an average. These are fairly common codes, but here's where I want to start to look is what's the value of one to the other? I see commonly a lot of chiropractors say, oh, I charge 60 for a 98940 and I charge 70 for a 98941. And frankly, that's like stabbing me in the heart. I'm like, why did you choose $70? And they go, well, that's what I think it's worth, not understanding the value. And there is no way a 98940 at 60 should have a 98941 at 70. That matches nothing about the relative value. So by example, the relative value for a 98940 is 0.81. Now you might look at that and go, what does that even mean, Sam? Well, that's its relative value to other codes. So until you see it in context with other codes, it doesn't have as much meaning. But let's take a look. The RVU for 98941 is 1.16. So let's make this the simplest way I can. If I say a 98940 is $81, what would be the value of a 98941? 116. So the essence I want you to see here is that whatever charge you have for a 98940, whatever that amount is, the price for a 98941 should be about 35%, maybe even a little bit higher than that. So if you're charging 60 for a 98940 and charging 70, you're undercharging by about $25, meaning you're losing 25 per visit. Let's take that to a bigger way. I find often doctors undercharge 10 to 15. Let's assume you're doing even 100 patient visits a week, and about half of those patients are probably 4-1s. That means you're losing somewhere around $600 to $700 per week just off of the one code because not understanding the value. The same applies with 99203. Notice 99203 is roughly 4 times the amount of what you're billing an adjustment. So if you can tell me what you charge for an adjustment, I will tell you what the fee is for a 203, or a 124 is slightly higher than an adjustment, 1 to 2 regions, but lower. So you might think, well, Sam, how do I use this? What does this really mean to me? And where do I start? People think, well, what fee do I start with? Well, here's what I would suggest. There's a code you probably bill on most all patients, which is an adjustment code. And I would pick the one that's most common that you've seen that insurance companies pay and allow, and make that your starting point or your basis. So by example, let's say you're charging $65 for an adjustment, 1 to 2 region. I take my 65, and you'll see here I divide it by 0.81, and it gives me 8024. Now 8024 is not a price, it's my conversion factor. So I'm now going to take 8024 and I'm going to multiply it by any other code's RVU to tell me the price. So in simple terms, if you can tell me the price of one code that an insurance pays outside of ones that are, of course, managed care, I can tell you what they're going to pay for every other code because everyone uses RVUs. So here's the example. I then take 8024 and I multiply it by the RVU of 98941. Notice it's 9303. So the example I gave earlier, if you're charging 60 and 70, notice the difference in price here. They're losing probably about $20 to $25 by not understanding. If an insurance is paying you 65 for a 40, a 41 would be 80, again, outside of managed care, personal injury and other. Well, how about for an exam? Take a look at this. 8024 times 3.29, and you go 263.98. You may go, wow, that's way higher than I want to charge. And I will certainly say, I'm not here to try to tell you to charge more. I'm really not. But I'm saying start to look to think what's reasonable. If you say to me, Sam, I know based on the reasonable charges, RVU, I could be charging $260 for an exam, but that's so far above what my area would allow. Maybe you charge $200. I would say that's fine. Why? Because you've made a conscientious choice to choose it, not because you thought that's what it should be. You made a decision on the value of the area. And let's do just the last one, 8024 times 0.88, 7061. So notice the price of a massage is slightly higher than a 98940, and I will guarantee most of you don't do that. I consult so many offices. We have a network service where one of the things I do with them is to go over their fees once a year. And I invariably find, particularly for new offices, they have probably 3 or 4 codes that make no sense. By example, an exercise code has a value of 0.87, which means higher than 98940. And I bet many of you charge your exercise fee below a 98940. not understanding the value. So I'm going to give you an example further of this, where this works. Now, I've just chosen Illinois. Why not? Illinois, I just picked that. That's a state we go to quite a bit. And I've chosen, this is the Medicare rates for Illinois. Now, specifically, the area 16 is Cook County. So I wanted to pick Chicago, maybe the more expensive area. And you'll notice they allow 2903 for a 98940 and 4138 for a 98941. So let's do the RVU with that. Notice I take 2903 divided by 0.81, it gives me 3584. I then take 3584, divide or multiply by 1.16, and notice it gives me 4157. Now you notice it's off a few pennies, but you notice how close that is. If you did that with every code, you would find that you will find it within pennies. So I'm going to suggest, let's start taking codes you commonly bill and do that. Now, here's a way of also thinking of it. I picked Illinois for this reason. This is the company Blue Cross Blue Shield of Illinois, specifically for employees of Boyne. And if you look here in that fourth paragraph down, the last one before it says questions, notice it says, starting January 1st, 2021, the Boyne Health Plan is updating the predetermined percentage of Medicare allowed charges to the percentage listed in order to align more closely with market standards. And notice it says professional prices, 175% of Medicare. So now if I go back here, and if you think of what's 175% of Medicare, at $29, it's not quite double, but that's going to be like 55. So that's certainly still well above the Medicare rate, but it's going to give you a good starting point, which would mean if my rate is $58, and I'm just doubling it for simplicity, for a 4.0, what would be the price of a 4.1? 81, or excuse me, 82 actually. And so you can start to see how this works. What I'd like you to do is, if you're not familiar now, for those of you who have the digital coding from HJ Ross or have access to it, these are the common RVUs for the codes that we use commonly. And you'll see here I have listings of chiropractic codes, therapy codes, exams, but I'm going to say focus here on the codes you bill commonly: evaluation management, chiropractic, and probably physical medicine codes, or whatever codes you use commonly. You really don't need to have and know hundreds of codes. You need to know the 10 or 15 you use commonly. So here's my suggestion. Put together a sheet like this. I'd love for all of you to do this year. Put your common codes. You're going to notice here I picked two of the exam codes: new patient, established patient, lower level, 02 and 03. I put the adjustment codes and then two therapy codes with RVUs. That way you can start to know, okay, if I'm going to charge, a 98940, you can see a 42 is going to be not quite double, but close. So what I'd like you to do, though, is put columns together, as you'll see here where it says RVU. Then notice the next price is going to be your time of service. Maybe you're doing cash, at the time of service discount. Okay, put that price. But then the next row, I want your regular insurance price, because I'd like you to see, let's make sure that these fit within RVU. And if they're not, why not? But then the next columns, you notice I put all the common insurances, and these may not be common for you. I just threw some out there: Aetna, Blue Cross Blue Shield, Cigna. And what I'd like you to do is to list, what do each of these pay? Now, the work comp and Medicare are easy if your state has a mandated fee schedule. And then the other ones, because what I'd love to know is which plans pay me better than others. Most chiropractors aren't aware. Sometimes you think an insurance is good and your staff is going, oh my God, doc, it's horrible, because you're not looking at the actual reimbursement. This way you have a good sheet of what's going on. So when someone calls you and they say, hey, I have Cigna, you'll be able to go to this sheet and immediately tell them what's going on. Now, remember, we did it last month where I talked about the no surprise billing. How easy would this make this to make sure patients are aware of what they charge? But more important than that, I want to know what I'm getting, because if I'm getting better payment from one of these, I want to figure out, how do I market to those people? How do I get more of those patients in my office? Ultimately, though, again, I want to highlight about using RVUs and conversions. Here's just some examples. Notice in Texas, the work comp fee schedule takes 6117 to multiply by the RVU. Now remember, the work comp one is about 33 to about 38, depending on your state. Notice Utah, 56 and 52. Get this, look at the third one, Michigan. If you're in Michigan, how do you figure out your fee schedule for PI? It's 200% of Medicare. How simple is that? Double Medicare prices. I would suggest most of you, at the very least, should probably go 1.5 of Medicare or higher. And if you did that, it would follow RVUs. But you can see all the examples here of how this follows up: California work comp, Pennsylvania, Oregon, and so on. Start to make a fee schedule that makes sense. So when someone disputes your fee schedule, you're going to say, no, I am billing usual and customary. In fact, here is how I developed it. I'm using relative values with specific conversions. Hard to push back on that because you now are speaking with knowledge and information that has to be followed. Now, I do want to make one statement though. If you belong to a company like ASH or some of these other plans, they have a proprietary fee schedule. And frankly, that's what you signed up for. So they don't follow our views. They're just going to say, take it or leave it. I get that. But should that dictate your fees for other services to other payers? No. Remember, I'm not going to take my lowest paying insurance to assume that's the usual fee. While I may not take the highest one either, I want to be somewhere in the middle because I will tell all of you, you are probably undercharging. And so, how do we get information to you? Well, this is our news page. You'll notice here I have stuff on vaccine mandates, things about chiropractic. Please take a look at hjrosscompany.com. Go to our news site. That way, you always get the most up-to-date information. That news section is updated weekly on what's going on. We're here to make sure you've got the right information. We are your advocate, ChiroSecure and HJ Ross. And to do that, if you're looking going, God, that was a lot of information, Sam, in a short time. We do seminars on this. Go to our website, or even better, we have a service where I work with you one-on-one called The Network. Go to our site, look at this page. It allows me access to you or you to me on any type of question. In fact, if you're a platinum member, you get a monthly seminar just designed for you and one-on-ones all the time. We're here to make sure that your practice is continuing to thrive and expand and understand the fees. If you're having a hard time with that, reach out to us. We're here to help. Now, I'm going to say thank you all very much. Again, I wish you the best. And I will say next week's program is going to be Mike Misko, so stay tuned. And I look forward to working with all of you in the future. Take care, my friends.